Thank you, Michelle, and good morning, all. And I would reiterate that I think we are very fortunate to have a superstar as our keynote speaker. Gretchen is actually a product of Stanford. She did her undergraduate degree at Stanford, her bachelor's, her master's, and her PhD, all at Stanford. So it seems appropriate that she catalyzes our research convening. She's an ecologist by training, but her work actually spans both research, public education, and this really important part of Stanford being an actor in these great global health problems of our time. She has really reached out to leaders in business, in government, and really working towards implementing solutions to great environmental challenges. Gretchen's scientific research is what she calls countryside biogeography. So I think that'd be kind of nice if we could have an undergraduate major in countryside biogeography. And this is really a scope for harmonizing biodiversity, conservation, and agriculture, and importantly, quantifying the production and value of ecosystem services and conservations across landscapes. So one of the reasons that this is also such a trying time globally is that humanity is destroying the earth. We're destroying our biome, and global health recognizes that the human future as biological creatures is tied to the earth. So Gretchen's work thinking about what are the broad values of ecosystem, and can we model and understand those, and can we communicate them, the value of natural capital is critical for our time. So Gretchen works a lot with private landowners, with economists, with lawyers, with business people, and even occasionally with government agencies, maybe now with government agencies and other governments, as well as domestically. And her efforts are truly global. Fortunately, she was willing to adjust her schedule and just got back from Costa Rica last night. So that she has some time to speak, I'm not going to list all of her awards, but I do want to mention the Blue Planet Prize that she won in 2017. And this is widely considered the Nobel Prize for science that contributes to global environmental problems. So, and she's been elected to the American Philosophical Society, the U.S. National Academy of Sciences, the American Academy of Arts and Sciences. We're really fortunate to have her open our convening today, and I look forward to hearing her talk about global health driving research, innovation, and impact. Gretchen.
Well, good morning, everybody. Now I am really nervous after that over-the-top introduction. But basically what drives home is just how nice everybody is here. So I really appreciate the invitation to talk here and the really warm welcome. And don't believe anything Steve just said, but let's dive in. There's so much potential in the opportunity that we have before us now, and I just want to reflect on some of the dimensions of opportunity that we might seize together in building on the work that's been done and driving the innovation we can spark here at Stanford and across our global research community into much improved health outcomes around the world. So let's just jump in. I'll start off with Costa Rica, where I was this past little bit, a place that's had a huge impact on my life. The people there are so forward-looking, certainly in policy arenas, and landholders really remarkably flexible and innovative in adopting new practices and things. And one of the things they did is kind of at the forefront of our thinking today. And that is, back in the 90s, they had the highest deforestation rate on the planet. They were the poster child of sort of environmental destruction. One of the leaders in the country, Alvaro Umana, whom many of you know, he got a PhD here at Stanford in civil engineering and especially hydrology, knew the value of forest in regulating water flows, helping to control flooding, managing hydropower production efficiency, and hydropower is one of the biggest exports from Costa Rica to neighboring Nicaragua and Panama, and recognized, the link to health. And he set up the first Ministry of Environment and Energy, linking environment and energy to make the environment as powerfully influential as energy and other infrastructure and such is in decision making. And implemented, when he did that, a program that recognized the value of forest in delivering all of these benefits to people, in promoting development in the country, and basically in cracking open a pathway to green growth that allows countries, or whatever the scale, cities, to improve the environment at the same time that you're improving economic and other aspects of human well-being, certainly including health. So the way it started out in the country is as this national payment system for the services that come from ecosystems. And those that there was enough science to justify back in the 1990s were these here: climate stability, water purification, just biodiversity benefits kind of writ large. At the time, it was Merck Pharmaceuticals was investing to enable bioprospecting in the rainforests of the country, and that's obviously become a big area of some contention now too in terms of the IP, but that was the intent, and there was a lot of goodwill in setting all this up. And then scenic beauty, given that Costa Rica has tourism as one of its biggest economic sectors, as well as hydropower and other things. So this might not look like much, $20 per acre per year. Who would sign up for that? But the payment was set to be low just to work the kinks out of the system. Overnight, the system was flooded with people volunteering their land to have rainforest either restored or protected on it to achieve kind of a wide array of benefits in people's minds, these here plus others that locals value. And this program has become tremendously successful. The country has gone from that poster child of destruction to now what we all think of today. Sorry, I've got a bug in my throat. A poster child of sort of conservation and sustainable development. They have net reforestation, one of 7 countries to have achieved that. And the big question is, how much can Costa Rica, in a way, influence the world? And it might sound kind of crazy, a country of only about 4 million people, yet they have had tremendous impact. And I'm going to jump now to China. And in setting this up, what I want to emphasize is how much demand there is for the kind of understanding that we can generate and basically accelerate the generation of as a community. So in China, as well as in Costa Rica, there's leadership demanding much more rigorous ability to incorporate values of nature into planning in order to achieve the broad objectives of development, including certainly health outcomes at the forefront. So the current, President Xi Jinping is famous in China for saying this. It might sound crazy. Clear waters and lush mountains are gold and silver. We will not trade them for gold or silver. Everyone in China knows now this sort of saying, and on the one hand, the drivers of destruction, environmental destruction, are still going strong in China. At the same time, though, there's another hand that's becoming really influential with really strong support from the top to completely transform what they call the financial system of the country, the economic system, and to open up, again, green growth with massive investments that I'll describe a little bit later, where health is kind of a primary desire for policymakers as an outcome. And yet the science hasn't yet been delivered in the powerful way needed to achieve that. Oh, you're really kind. See how nice people are. Thank you. So in China, we're aware that there's been massive flooding. There's, the air and water is poisoned. Even the most iconic elements of nature, like the giant panda, are in kind of dire straits. And yet leaders are asking, and they're coming to Stanford to ask this question, or set of questions, where and how much should we protect in order to achieve development and health outcomes? How to secure, how can we go about securing nature and human well-being at the same time? And how can we move beyond metrics like GDP that have had such an influence since the 70s or so, when China opened up, in driving policy? And in all of these, they're making incredible change. And I'm just going to show you now basically a movement that's underway globally to drive the kind of science that this community is generating into policy. And I know there'll be a number of other perspectives given today on how to make that impact with the innovation that we can generate here. And the bottom line of what I'd like to put across is just that there's so much demand, and there's real opportunity here at Stanford to tune our science to meet the needs of policymakers, of decision makers, who want to know basically, and this is where we've got kind of a research engine up and running, what the impact of alternative decisions is through looking at scenarios on ecosystems, and through biophysical modeling, quantify what the impact of those changes in the conditions and processes in ecosystems is on services like flood control or just a wide array of other things, purification of water, stabilization of climate, the things in Costa Rica's nascent policy, pollination of crops, food security, and so on. And then the big gap where we haven't gone very far is linking those changes in services, often expressed in biophysical units, like of flood risk, or risk of different climate extremes, or risk of crop failure because of lack of pollinators, that sort of thing. We're not very far along in making that link, especially through health, to quantifying impacts on human well-being. That's where there's a huge opportunity. And then on the left side of this little schematic, though, we are pretty far along, as I'll show you now, in linking with decision makers. So there's kind of a pipeline here through which we could inject new understanding relatively easily with a lot of the sort of infrastructure set up. And I just have to touch on, I can't believe Steve mentioned countryside biogeography. I'll say how I got started in this really briefly. It was in Costa Rica, seeing that a lot of farmers do keep little bits of forest like that you can see in the background here. And they all have different reasons for doing it. And here there are people grazing cattle and also producing coffee and many other crops. And one of the reasons people would say had to do with pollination. And we went out with a team of students and managed to quantify in a set of pretty elaborate experiments the role that forest plays in supplying pollinators. And in this case, it's for coffee, which isn't very nutritious, but it's essential, as I could see everybody felt out at the coffee and tea station there. Improving yield by 20%, improving quality by 50%. Just being able then to quantify what the return on investment is to farmers of having little elements of forest configured across a farming landscape. Then we looked at pest control. There are a lot of dangers using modern-day pesticides, and many of them aren't effective for many tropical crops, especially, such as in coffee in the case of the worst pest. And we found that birds like this scale-crested pygmy tyrant that always gets quite alarmed when you catch it, it reduced the infestation by 50% on farms near forests. So it's that kind of research, and then bringing in a bunch of people from the medical school led by Hannah Frank with Steve as one of her advisors, trying to understand the health implications. And there again, I'd say it's complex. We're looking at the many bats that live in and around these farms. I should say, there's about 300 bird species that we've been trying to come to understand in terms of their impacts on human well-being. And with bats, there are about 80 species out on a farm like that shown here. So there are many connections and a lot of things to illuminate. But the heartening side of this is that there have been thousands of studies on the ecology side and moving closer and closer to the health arena, where people, and there are many ecologists in the room I know, are just so keen to team up and collaborate and develop the level of understanding needed to inform policy and governance. So going to this pipeline now, the partnership that we've set up at Stanford involving now about 300 other partners around the world. But these core players here, the Chinese Academy of Sciences, Stanford, University of Minnesota, and then these two global conservation NGOs. That's how we got started, but we're moving much more into partners out in human development, in health, in finance, and other areas among the 300. Our aims are, to co-develop knowledge, package this up in a way that makes it accessible beyond the bounds of our academic institutions, and try to systematize an approach. And we've come pretty far along in that over the past 15 to 20 years for valuing different types of interventions to achieve human well-being, the interventions involving sort of nature or ecosystems. So what we've developed so far is a suite of models that are up on an open, freely accessible platform that has data, global data on the environment. We're building in more data, sort of place by place, that's more social. But global biophysical data on natural capital, models that are now codified in software that's relatively easy to use by decision makers in government or development banks or what have you, to quantify how across different landscapes or seascapes investments in ecosystems would play out. And these are kind of the arenas. The models are packaged up into a software called Invest for integrated valuation of environmental trade-offs, environmental services and trade-offs. And this has been used in about 185 countries, so it's definitely getting out there. We have regular training programs. The next big convening is the week of finals this quarter, so the 19th of March. It's on campus. Everybody's more than welcome to come. People will be there from about 30 or so countries, leaders driving this kind of investment, and we have some key people speaking on the health front. So, and it's been growing over time, and this is a key moment where we could add a lot more in the way of models, certainly working on the science, and then tailoring tools to different types of users and applications. And by applications, let me touch on tools, then we'll get to applications. On the tools, what would we add next? What would make most sense strategically, given the state of the field and understanding different types of, say, mosquito-borne diseases, or schistosomiasis, run by Giulio De Leo's group, nutritional health, other things. Where could we make an immediate impact by synthesizing what we know and integrating it into this open platform that's now being adopted much more widely? In terms of the adoption, we're working directly in about 60 countries, so there's opportunity basically through Stanford to engage in these places, and then across the planet through partners in almost all countries. And the focus is in kind of these sort of demonstration arenas listed here. The biggies really are development planning and urban planning, like just to put a fine point to it, with then water and resilience along coastlines and such playing in, obviously, into both of those arenas. And just to give you a sense of a couple opportunities, in Latin America, to give you a taste of how this works, the huge issue that we're reading about for Cape Town right now, but that played out in Sao Paulo a couple years ago, and that's kind of sweeping the globe, is water security for cities, especially in a time of rapid urbanization and population growth, relatively poor infrastructure, and then changes in climate. So you can see, looking in Latin America, there are a lot of downstream users getting water from places that are often a world apart. Up in the Andes, say, this Quechua-speaking community here, for many different uses. And the approach that's now being replicated across Latin America involves downstream consumers coming together and investing in upstream changes in land use and even, land cover to achieve water security. And what the science tells us is how to target those kinds of investments. So how much should be in, say, in the top left panel, in protecting existing forest versus going out and planting new forest in the middle, or going out and changing agricultural practices where you maintain agricultural livelihoods. And where would you undertake these investments given the vast arena over which you could think about doing so? So the software here's for the Cauca Valley in Colombia, which was really innovative in picking this up first and inspiring much of the rest of Latin America. These are all different watersheds kind of on their side, feeding down to the left into the cities. Tuluá is one of them, and you can see the models or software just show you where you would make those investments. So in reforestation up at the top, or forest protection, and then reforestation in blue, fencing, areas of enriching, the understory, all to limit flux of farm chemicals and especially excess nutrients into water supply and help reduce sediment, things like that, and improve timing of flow and storage of water for the dry season. That's just to give you a taste of how it works. And in here, you can see under different budget levels, you can estimate what the improvement in water quality would be for a given portfolio of investment. That's just a sense of how what's pretty complex science is packaged up into a form that can be useful in a specific decision. So all across Latin America now, in 40 cities, all the big cities, they've adopted this approach, and we're trying to scale it now in Africa and in Asia. So that's an arena where we could add health much more explicitly and there's a lot of neat research coming out on this to make this more impactful in terms of the goals we all share. And now just in closing, I'll mention a bit more on China and say that in this meeting starting on the 19th of March, we're going to have the guy who runs the NDRCs, the National Development and Reform Commission's Department for Development Planning. He sort of controls just a huge part of the government in terms of budgeting and finance, infrastructure investment, planning across the country. They've bought into this approach, and we've kind of been co-developing it over the years. And they're really keen to add health. So it's just one other place where we could do that. What they're doing now is modeling out for the country, where to make investments in natural capital from a national kind of priority perspective, and it's also being done at local scales. So in any province, any small county, there's this kind of planning going on with about 200 million people today being paid to restore ecosystems in order to achieve these development objectives, poverty alleviation, looking at many dimensions of poverty and of, aspirational development. And there's a lot of detail here that obviously I'm not going to go over, but trying to target from a social perspective as well, which sort of people could benefit the most and with whose participation the country could benefit the most. And they've adopted, a lot of the science we need to get this going, like a whole system of natural capital accounts. So alongside GDP economic accounts, they now have natural capital accounts that pinpoint with really refined data, and many countries coming just to see what the Chinese are doing to replicate this. Exactly where each calorie of food is produced for about 500 different food types, where the carbon sequestration is going, sandstorm prevention, where you would invest to reduce that massive problem. Water supply, what are the most important places from a city perspective, where to have new national parks and how to fund them. All this is just sweeping China now in this massive system of green finance that they're trying to set up with the wealthier and mostly urban places, injecting investments in the places that supply well-being in cities. And along with this, they're developing a new metric called gross ecosystem product that will be reported alongside gross domestic product in determining how resources are allocated. And they're bringing a bunch of provinces here that score very highly in GEP and relatively low in GDP. And yet they're a key part of this new financial system and are being rewarded for ever increasing their GEP. They're also really into cities, and we're working to develop our software now for use in cities globally with these 4 Chinese cities as a starting point. Also San Francisco Bay Area and Minneapolis, St. Paul in the US. And just to close, I'll hit on a few lessons and then open it up. And these lessons, I don't know how they'd apply in the health context. It would be a great conversation to be having, and I bet you're having this conversation already. But one is just that the process of co-developing knowledge is at least as important as the particular science and tools and kind of outputs that we generate. Just developing a deep understanding with decision makers, as I think is typical in the health arena. Second, it was daunting at first to realize how complex these ecosystem processes are, these planetary and often micro processes are, and how to package them up in a simple way. And yet we've found the simple approach to be very compelling. We've put a lot into making hydrology models, say, much more simple to address a particular problem for a city, rather than giving you, every detail someone might want to know about a hydrograph over a year. In a city, people are going to want to know 3 things, say, and we can simplify to make stuff more useful. Third, the experience over the long run, whether this is impactful, we've certainly come to appreciate from the very beginning, depends so much on building capacity and local ownership and involvement, trust, and sort of shared success. So a huge part of the effort is focused in a very rewarding way on that. Fourth, at the beginning, I was often called, like Miss Price Tag on nature, and people had the impression I'd get written up in different places as just wanting to slap a price tag on the priceless. But so I worried a little bit about, on the one hand, we do want to get the economic dimensions of value out there where we can quantify those in a meaningful way, such as in regulating water flow for hydropower. It's actually quite easy to quantify the economic return to doing that. In many other cases, it's not very meaningful to put a dollar metric on, but there are lots of other meaningful metrics. And we've found decision makers are really keen to use those other metrics. And then later, you often compare different scenarios of investment, maybe on a dollar cost-benefit basis. But in all of the analysis that feeds into the ultimate decision, you're using other metrics, like how many people are at risk of different health issues. Fifth, the big gap, I think, in linking biodiversity and ecosystem services, BES, with human well-being is on the health front. And we've come a long way here wanting to engage much more deeply with the health community, and I just see this as an incredible time and opportunity. And the last thing to mention, and I'd love to get your sense on this later, is just how to communicate uncertainty. On the one hand, again, and especially being in academic research, we want to get everything right. And our community would say, we're not going to get it all right, but what we can do is communicate very clearly what we know and what we don't know. How we do that, though, is often tricky, in different contexts. There's so many different audiences, and they have different sort of tolerances or acceptances of uncertainty. Everybody plans with uncertainty, so we can't be paralyzed by uncertainty. But at the same time, this is an arena where we need to work more to define effective ways, useful ways of saying what the biggest uncertainties are, and to build trust in that what we're developing is something co-developed to serve needs in a way where we're sensitive to the risks of getting things wrong. So that's the upshot from me, and I just want to thank you again for the chance to come and listen to all of you and learn kind of what the frontiers are here in your minds and in your labs and everything, and to end with a really big welcome to hear what this community sees as most vital in terms of next steps, and then try to orient this community I'm more a part of around what you see as most important, so that we make the most of our chance to work together. So thank you very, very much.
Thank you very much, Gretchen. I want to invite questions from the audience. So you've raised a number of really exciting issues, I think, in the best spirit of taking scientific complexity and working to make a difference in the world, and also looking at this particular need in the ecosystem services realm of can we help quantify some of the health benefits from improvements in ecosystem services. So questions from the audience.
Gretchen, that was wonderful. Thank you. I was just sitting next to Steve and saying how embarrassing it is that China is doing all this green finance. Can you give us some examples of what's happening in the U.S.?
Oh, okay. Let me say the main thing I'd like to say to that is once I got out of my depression over how things were likely to head for a few years, I found it uplifting to see how much initiative there is at state levels and below. There's tremendous opportunity in the U.S. California, stands out as a hallmark, really, of driving these approaches. And even right nearby, in our Bay Area project, we're working on a 3-meter sea level rise. That's the game plan. And I hadn't realized, roaring up 101 to meetings and things, that a lot of the construction along there that is slowing traffic is actually to prevent the climate extremes we're likely to experience from being utterly devastating. And it's actually quite inspiring to go out there and see. They're converting a golf course into a marsh with a new type of levee that's highly engineered and will pop up and down as needed in theory, and integrating nature for its mental health benefits. Google and Facebook and other companies along the Bay Shore that are investing in this are really keen to understand that dimension of health that has been led by a bunch of people here at Stanford and globally, and we're developing this mental health module as part of the INVEST platform. So I'd say in the US, there's actually a lot of opportunity, and in the week of March 19th, we'll have a bunch of leaders from the US laying out what some of that is. So we do have a lot of demand for this, certainly along coastlines, building resilience. Water funds are taking off across the US, and there are a whole bunch of other contexts in which there's the chance to drive change now. We're having a big meeting on Monday that you'd be welcome to as well. The California Secretary of Agriculture is coming and wants to redesign agriculture across the state in the face of drought to invest in ecosystems for health and other types of outcomes. So that keeps me buoyed. Thank you, Michelle. And you had your hand up, did you?
Please come to the microphone.
When I toured a few farms in China recently, I was very impressed how open and welcoming they are for the genetic engineering of food plants. Flying back over Europe and here to the United States, GMO is the absolute devil. I mean, we're still growing our corn plants like I guess the Mayas did. So do you think this is going to change, or can we be a little bit more open to that?
You're hitting on a key problem. I can give a personal view, I guess, and I don't know what's likely to happen in the U.S. context. It's so deeply cultural and so ingrained, and but I personally feel that responsible genetic engineering of crops is crucial for delivering the nutritional benefits, the environmental benefits, and many other outcomes that we together want to achieve. So that's my short response on that one. What happens is beyond me, what's likely to happen here on that front, and I bet there are other experts. Hey.
Great talk, thank you. You framed a lot about the benefits of making these types of investments in ecosystem services, especially in the face of like a changing climate. Do you ever frame the risks of inaction, and is that a beneficial way of approaching it?
Yeah, absolutely. You're good to bring that up. We often, I'll give you an example in California actually that gets at that and will help lift Michelle up a bit more. So here's a case. We often phrase things in terms of the risks or costs of inaction, and then the way we can counter that. So in California, we have heightened risk of wildfire that we can all appreciate. Most of our water comes out of the Sierra Nevada, the mountain range, and the U.S. Forest Service doesn't have remotely the budget to either manage the forest so as to reduce fire risk, or even to go out and effectively, manage fires once they erupt. So what we're developing is a forest resilience bond, together with it's a pretty amazing set of investors, state pension funds, water utilities, hydropower facilities that don't want all the sediment that results after fires going into river systems and damaging their turbines, agricultural water users, and a suite of other players, quite diverse, some cities investing together to manage forest in a way that will reduce that fire risk and also improve health of the forest and achieve other sort of ecosystem co-benefits of climate security, storing more carbon, biodiversity-related benefits and such. So that's a case where this bond initiative is framed entirely around risk reduction, and the science is on quantifying that and trying to make the return on investment apparent to sort of impact investors.
One last question, Gretchen.
Okay.
The impact of environment on health has been characterized as slow violence, that there are toxins and consequences in the environment that disproportionately impact the poor and people who are dispossessed. There's a difficulty of time frame between the environmental harm and the human health outcome, a time frame that can stretch into decades. Mm-hmm. And so it makes some of this valuation challenge for ecosystem, although very real, somewhat more difficult to link. Mm-hmm. On the other hand, it seems that you must have other time challenges in terms of linking exposure to outcome for other services. And I just wonder if you can think about helping us who struggle in the health field, linking ecosystem services to health with these big time delays.
Mm-hmm. Okay, you've hit on a key topic. I'd say on the policy front and the science front, they're two different things. On the policy front, what we tend to do is go in with whatever the biggest issue is that has the attention, the focus of policymakers, and then address that. Often it's water, for example, and then we try to bring in all these so-called co-benefits that might be realized over much longer time horizons of much less interest to the current suite of policymakers. But there is an openness to bringing in co-benefits in developing these finance mechanisms like the Forest Resilience Bond. On the science side, that's a tricky one, and it's hard to give a general response. I'd say on the one hand, strategically, it's worth investing sometimes specifically in things like the recent work showing the stunting effect of air pollution on fetuses over their lifetime. It's going to be a long process of developing the science to substantiate those kinds of long-term effects. I guess I've seen that as something that we're just going to allocate X% of our research budget and effort to. And X might be really large because a lot of these effects do play out over a long time horizon, while at the same time allocating enough to the much more kind of acute and immediate things to maintain the relevance of our community and approach in decision making. It's that kind of tension and strategy, I think, that we've tended to take. But that, what you cite, is probably our biggest problem in a way, is that it's hard to say day to day. That's where this gross ecosystem product measure, I think, will help as well. If we can start shifting the focus away from just GDP types of metrics, we'll be able to capture much more of that longer term change. Well, thank you again. I'm really excited by what's going on here, and I look forward to interacting a lot more. So please email me if you want to get involved in March, and otherwise we'll find other ways to catch up. Thank you.
Thank you very much, Gretchen.